mic check, please.
Hey everybody, welcome back to the Ducks Unlimited podcast. I'm your host, Chris Jennings.
I'm your host, Dr. Mike Brasher.
My name is John Gordon. I'll be your host.
And I'm your host, Katie Burke.
Welcome to the Ducks Unlimited podcast, the only podcast about all things waterfowl. From hunting insights to science-based discussions about ducks, geese, and issues affecting waterfowl and wetlands conservation in North America. We bring the resource to you, the DU Podcast.
Hey everybody, welcome back to the Ducks Unlimited podcast. I'm your host, Mike Brasher. Today we have another episode where we're going to talk about and sort of an update on the latest with highly pathogenic avian influenza. It's a topic that we've discussed a couple of times already. We have a new guest that I'm really excited to join to the Ducks Unlimited podcast, Dr. Julie Lenoch, National Coordinator for USDA APHIS Wildlife Services Wildlife Disease Program. Dr. Lenoch, welcome to the show.
Thank you so much. Happy to be here.
You might hold the distinction of having the longest title that we have yet used on the podcast.
We could just say that I work with the National Wildlife Disease Program and call that good.
Well, all the same, it's great to have you here. You are based out of Fort Collins, if I remember correctly. Is that right?
That is correct. Our team is based in Fort Collins for the coordination group, but we have field disease biologists throughout the United States who, of course, are working on this and many other outbreaks and disease situations. So we're a national program.
If you don't mind, maybe take a few minutes to introduce our audience to yourself, your background, how you ended up in the position that you're in, and maybe a couple of the places you've stopped along the way.
Sure. I'm a veterinary epidemiologist by training, and I've worked for the United States Department of Agriculture for about 6 years. I've been in the position I'm in right now as the national coordinator for around a year and a half, and have previously served within the USDA Veterinary Services, also working on outbreak and disease programs. And prior to that, I had a postdoc fellowship for the Center for Disease Control and Prevention, and I've worked with the Department of Interior at the National Wildlife Health Center. So I've kind of had a meandering path doing various roles in infectious disease and disease control programs, always at this wildlife, livestock interface and working on disease emergence.
We're here today to talk with you about highly pathogenic avian influenza, and it reared its head, so to speak, earlier this year, well, late last year, but it has really kind of taken off and spread in a not so welcome fashion here over the course of this year. And so I do know that it is consuming a significant portion of your time right now. But just briefly, what other big wildlife disease issues is your group working on? I'm certain that chronic wasting disease is near the top of that list, but any others that our listeners would have heard about?
No, it's great question. So yeah, chronic wasting disease, of course, a big concern for our cervid deer folks and many of our state managers. We also work on African swine fever, which is a disease that we do not have in the United States, but was recently detected in the Caribbean. And that disease is a threat to our pork industry. So we have large teams working in the Caribbean to assist other countries and have basically escalated our surveillance and our testing in feral swine population where that could be a detection. So we're working on African swine fever in the southern part of the United States and the Caribbean, chronic wasting disease in multiple states, and highly pathogenic avian influenza, as you said, which has been a large-scale outbreak essentially across the U.S. right now.
Here's one of those questions that occurred to me as you were talking there, but I'm kind of curious, how much of the work and mission of your agency is driven by concerns for our commercial industries, our commercial meat and I guess agricultural industries versus concern for the wildlife populations themselves? You know, all are affected, but I'm kind of curious about the relative priorities of those within your agency.
So wildlife disease and wildlife management are complicated, and we work with multiple partner agencies because we have slightly different mission spaces, as you just suggested. So I work for the Department of Agriculture, and the diseases that I'm assigned to and that we prioritize in general are those diseases that may exist in wildlife that are a threat to agricultural products or systems. Some of those same diseases could be an actual threat to the wildlife populations themselves. And we work very closely with our colleagues at the Department of Interior, both the USGS National Wildlife Health Center, the Southern Cooperative Wildlife Disease Study in Georgia, U.S. Fish and Wildlife Service. And in some cases, there's other partner state and tribal partner agencies. And I can give you a quick example. In this highly pathogenic avian influenza outbreak, it has spilled over into marine mammals. We've had detections in gray seals and harbor seals off the coast of Maine. And NOAA, the National Oceanic Administration, is the lead for marine mammal events. And so in that case, we're working with Department of Agriculture, Department of Interior, and NOAA, all on the exact same outbreak because it has its fingers and tentacles going so many different directions. So wildlife have a lot of people who work on it, and I'm happy to report how well that group does together. And we basically just share information and try not to duplicate things, but stay in our lane and provide useful information back and forth to each other.
I appreciate that answer. And I wanted to ask that question because a lot of the people listening to this episode, as we start talking about highly pathogenic avian influenza, and the name of your program is Wildlife Disease Program, there may be a temptation to think about, oh, well, this is only related to the wildlife themselves. But that couldn't be farther from the truth. And it relates to it's important to pretty much every single person in this country and in North America when you start talking about its effect on our food supply. It not only has a potential to affect that supply, literally supply of domestically produced food, but also the price of that food, as well as the economies that are connected to those to that food supply, and a whole host of other things, jobs, etc. Anything to add to that to kind of put a perspective on it, on why this is important to every person listening?
It's important, exactly as you said, and the USDA works closely with states and poultry industry to prevent avian influenza from becoming established in the U.S. poultry population. One of the focuses of that, of course, is keeping our nation's poultry free from avian influenza, which does help protect and secure both our farmers' livelihoods and the availability and cost of food. So there's a focus on the protection of our domestic birds. In this case, in the current 22 outbreak, we have seen a large amount of detections in backyard flocks. So this could be everything from a person in town who has 5 or 6 hens in their backyard, or slightly bigger operations that are rural but aren't commercial size. A lot of those have been affected by this current outbreak, and that is likely an exposure to wild birds who are carrying the virus and may or may not show any clinical signs from that. So we're trying to get the word out as much as possible, both for our hunting and waterfowl communities to be safe in how they're handling these animals, and how we're able to detect any further disease spread, and really trying to take that opportunity to do everything we can to prevent any further spread of the virus or any introduction into new species or new areas.
Julie, that's a great segue into a more detailed conversation here about this particular topic. So I think that's where we'll go next. And the one thing that I want to do is, for people that may not have listened to them or may not be aware, we did have an earlier conversation with on this topic with Dr. Dave Stalneck of the Southeast Wildlife Cooperative Disease Study. I think I got that right. They were episodes 368 and 369, where we went into a lot of detail on sort of the epidemiology of high-path avian influenza. And we're not going to cover as much of that on this particular episode. I do encourage people to go back and listen to that if you want that. But I do want, Julie, to give you an opportunity at a high level to remind folks of what is high-path avian influenza and why is it a concern?
High-path avian influenza, we call it HPAI, as it gets easier to say, are virus strains that are extremely infectious. They're often fatal to chickens, turkeys, and other poultry. And these viruses can spread rapidly from flock to flock. Historically, high-path avian influenza hasn't caused a lot of disease in the wild birds that carry it. However, in this 22 outbreak, the 2022 outbreak that we're currently in, things are acting a little bit differently. So we are seeing disease in some bird species this year in the outbreak in wild birds as well. So we're dealing with two different components of the outbreak at this point: the disease that it's causing in wild birds and the transmission from wild birds along the flyways that could be a threat to our poultry industry, and the introductions and the disease that it's causing in the domestic facilities themselves. So it's a complicated virus. It's causing a large amount of resources and folks working on it. And, it's been a prolonged outbreak at this point. And I don't think that we're out of the woods yet with the numbers that we're finding in our current testing. As fall and hunting season begins, we're still finding disease in a significant amount of our wild birds. So I don't think the outbreak is close to over at this point.
Maybe talk briefly, if you could, about the mode of transmission. You talk about waterfowl as a known vector, known carrier of this virus. What's I think Dr. Stalneck talked with us about the fecal oral pathway, the primary pathway, and then talk about why waterfowl are so, I guess, such prominent carriers of it related to the water and the mixing of that virus, if I remember that correctly. Can you speak to that briefly?
Yeah, so avian influenza does circulate in our migratory waterfowl and shorebirds, again, typically causing little to no disease. Since they're migratory birds, this allows the virus to move very efficiently along the migratory flyways in North America. In most cases, these birds are asymptomatic, meaning they don't show any clinical signs. They can shed the virus in their feces, and then there's a fecal-oral transmission route. Because the virus can live for a little while in the environment or in fecal material, people or trucks or boots, dirty boots or shoes, can also be another route for the virus to move. It doesn't have to be a direct contamination from the wild bird to domestic birds, which is why we really want to stress some changes of clothes, cleaning of boots, a degree of separation and a line of security, essentially, from anyone who owns backyard birds, anyone who works near commercial poultry or has any type of exposure. We really want to enhance cleaning and biosecurity in those situations.
Thank you for that review. There's a lot more that we could talk about there on the kind of epidemiology. I would refer people back to episodes 368 and 369 for more details. I want to talk about some of the commercial losses, some of the risk to the commercial and poultry industry and things of that nature. We'll get into a little discussion about risk and what we currently understand about its effect on wild bird populations a little bit later on. But to kind of put it in perspective, do you have any current estimates on commercial losses, where the number of birds or dollar amounts associated with the ongoing outbreak?
Yeah, so it's middle of October, and our first detection in wild birds in the United States was the laboratory information came in January, middle of January. So we're about 9 months in. At this point, about 48 million birds, commercial birds, have been affected on infected premises. We've had 240 commercial flocks and 288 backyard flocks across 42 states. At this point, we've had detection of high-path avian influenza in 47 states between detections in wild birds and in our commercial. So including Alaska, it's spread across most of the continental United States and has been detected in our Canadian provinces to the north.
Julie, this is one of those issues where if you personally don't see or feel the impact, it's probably easy to not pay as much attention to it. I was talking with a friend of mine earlier today, and he was telling me that I think it was his hairdresser has a backyard. This is in Canada. His hairdresser has a had a backyard poultry flock of chickens, turkeys, guinea fowl, and he was relaying a story that she was telling him how somehow their flock got infected and it wiped out the entire, almost 4 dozen birds in very quick order. So it's a real thing. I mean, you can tell us the numbers and we can read all of those. And until you hear a story from someone that you know or someone who works at a commercial, at a poultry facility or has lost a backyard flock, I think it's easy to kind of think out of sight, out of mind. But we're here today talking with you to try to do a better job getting people to realize this is an issue, and waterfowl hunters are a group that can play a very important role.
A really important role, both in allowing sampling of their birds if it's in an area where we're targeting or we're trying to get additional samples to understand where the virus is. We are continuing to monitor the viruses to see if there are any changes or mutations in the virus over time, and to really keep that information, exactly the information you were just saying. If we have a better idea where the virus is circulating or which wild birds may be carrying it, we can get that information both to our waterfowl hunters, but specifically to the hairdressers who have backyard flocks, because everything that we can do to inform people helps, trigger those activities that may be more beneficial and prevent those transmission. Once it gets into a little flock like that, it's really hard to have anything happen other than the loss of the entire flock. And that can be so devastating to folks with 5 or 10, a couple of dozen. Of course, our larger commercial operations may be in the thousands. So it's a great opportunity right now to share that we are still in the midst of this outbreak, and we do encourage everyone to maintain awareness and practice the highest amounts of security and disinfection that they're able to.
And just as a reminder, while we talk about waterfowl being carriers of this or maybe being infected with it but not suffering severe illness or death, that's not the case with let's say upland game birds, chickens, or certainly backyard and commercial poultry, right? And is that related to just the fact that they don't have sort of natural immunity? Can you remind me of the reason why they are so much more susceptible?
Yeah, it's an interesting evolution where it seems that the avian influenza viruses have kind of grown up with our wild birds. This particular strain, the H5N1 that's circulating, we've known in some format, it's been around since about 2003. So we're about 20 years into having knowledge of the current strain, or the lineage that came with the current strain has come from. And it doesn't typically cause a great amount of disease in our wild birds, but it is so pathogenic, so virulent in our poultry situations. And in this current outbreak, we've seen disease in multiple different groups of birds, meaning turkeys, layer poultry, our broiler industry, just multiple facets of the commercial industry, unfortunately, have been affected by this current virus.
And I think you've kind of alluded to this. Well, maybe this was before we started recording. You said that someone had asked you how many wild birds were infected by this, and it's like that's an impossible number to get right now. But what do we know? What's our current state of understanding on sort of the risk to wild bird populations?
So we have almost 3,000 detections at this point of high-path avian influenza in wild birds, and that's in 85 different species of birds. And that's a combination of information that I just gave in that 3,000 number. Maybe about 1,000 were picked up on surveillance, and that's our systemic testing that goes on. And that again comes back to our waterfowl hunters to allow us to sample apparently healthy birds. These are birds that aren't showing any clinical signs. There's no illness. There's nothing to indicate that they would be carrying it. That can be a little bit of the needle in the haystack, trying to find the virus in birds that look perfectly fine. About 2,000 of these detections are in birds that have shown illness or have died from the disease. So again, this outbreak in 2022 is looking a little bit different than what we've seen in the past. And finding the infection across all 4 flyways, all through the United States at this point in so many different species is really important. and helps us understand that we still have active infection in multiple wild birds and in a really wide geographic area.
Any progress or effort being made to test for past infection using the presence of antibodies in birds that are wild birds being tested?
We're doing mostly PCR at this point, so that's looking for current virus infection. There may be a time, and what traditionally happens is over time and with additional exposure, because we've been through these cycles before. We had an outbreak in 2002, we had an outbreak in 2015. Eventually, the virus will simmer down, not cause as much disease, and the birds will gain some natural immunity, which allows the virus to burn out. It's the same idea that we're seeing with COVID, and it's the same idea we see with nasty flu years. That the virus itself eventually should calm down, and our natural systems should build up their immunity, and we get back to a balance, and the outbreak goes away. It will be from the amount of virus and the current detections that we're getting as of September and October of 2022. We are still seeing a lot of active virus based on PCR. So we're not doing as much antibody testing at this point as still looking for current infection.
I have a question about something that I read here recently, that avian influenza, HPAI, this current strain, is being detected, and I think you mentioned this, but I'm kind of curious what's going on here. Being detected in mammals. I've seen a detection in at least a dog, maybe multiple dogs, and then dolphins. What's going on with detections in non-avian species?
We do have reports, and I'll correct that. We don't have any domestic dogs at this point. We do have wild canids.
Okay.
So we found it in foxes and coyotes. It's also been detected in harbor and gray seals off the coast of Maine, raccoons and skunks. The terrestrial mammals, the land mammals, are almost all carnivores. And so the theory is that they're likely grabbing the opportunity of a free or easy lunch, where there may be a sick or dead bird carcass that has virus that's shedding, and they consume it or get enough virus in their mouth that it causes that oral contamination and allows for the virus to cause disease. In the mammals, those have generally been juveniles, younger animals that have been infected. And I think that may be a combination of just less immunity in a younger animal in general, and potentially a higher dose than an adult animal would get. So they're eating the same size bird, but they weigh less. So it might be a higher inoculation, if you will, that allows for disease. Many of the mammals that we've seen, or the reports that have come in, have had neurologic illness, including seizures and tremors. And most of those animals have succumbed. It's interesting to see that's a spillover event. And at this point, we don't believe that there's any ongoing transmission, meaning it's a one-time event when that particular fox eats an infected bird. That fox may be infected and could succumb to the infection, but we haven't seen any evidence of it going from fox to another fox or ongoing transmission in mammals. But it's certainly something that we're keeping a close eye on with our wildlife partners and laboratory information that's coming in.
That's a great bit of information there. I had not read all of those details or seen those. So that's really cool. I appreciate you sharing that. And I think at this point, we'll take a break, and we will come back on the backside of the break here. We're going to get into some of the surveillance efforts that are ongoing. And then shortly after that, we're going to talk about the real important thing here, which is what's the role of hunters? What's the guidance that we need to be sharing with them, that they need to be aware of for their role, both in the surveillance as well as in minimizing the risk of this spreading into any other potentially risky area. So hang with us, Dr. Lenoch. We'll be back in just a few minutes.
Thank you.
Welcome back, everyone. We're here with Dr. Julie Lenoch of USDA Wildlife Services, and we're going to resume our discussion about highly pathogenic avian influenza. And Julie, I wanted to pick up with some of the surveillance efforts that are ongoing. Some hunters will probably be aware of this and may have found themselves participating in some of these surveillance efforts. So can you talk about what those surveillance efforts are and what's the goal for them?
Yeah, so our team coordinates a national surveillance that essentially goes for 3 seasons following the migratory birds' natural movement. So our seasons start in summer when new birds are born and the animals are leaving their summer breeding grounds and starting to move for fall migration. Typically in the summer, we do a lot of live bird capture and incorporate sampling from apparently healthy wild birds to look for the detection of any avian influenzas. And these are selected bird species in North America that represent the highest risk of being exposed to or carrying highly pathogenic avian influenza viruses because of their migratory movement patterns. So our biologists in the field will buddy up with state game agencies or wildlife management agencies and trap wild birds, swab them, and then release back into the wild. A lot of times those are done with banding activities or other type of research projects where they handle live birds. In contrast, in the fall, we will coordinate with hunting seasons, duck hunting seasons primarily, and look at options and opportunities to sample hunted birds. And our field biologists, again, just go out on the weekends and meet hunters where they are. Ask permission for sampling, and we sample those birds and send the hunters off on their merry way and use that information to collect, again, a targeted number of species and specific areas in the country that we look at, watersheds where we may find the best matching and mixing that may be going on of different species and different proximity, both to areas of concern that we might be looking for detection of disease if it's close to a poultry area, for example, or areas where we know that there's a convergence of multiple bird species. And again, we've got a better chance at finding the virus in sampling of those hunter harvested birds.
So, Julie, you talked about those surveillance efforts and helping you identify areas where the virus may be on the increase or maybe more prevalent. What examples of what actions do you take in response to the data that you're getting? And it may not be you, or your agency, but anybody else. You mentioned the proximity to commercial poultry facilities. Do they use this information to perhaps tighten down biosecurity measures? How's the information used?
Absolutely. The information is shared very rapidly. As soon as we have a detection in an area, and certainly into a new area, we share that information with our State Department of Agriculture, our State Department of Wildlife, our industry partners who may, make some changes as far as their biosecurity due to the presence of disease or the risk of disease creeping closer. We also share the information at this point with our zoos and other wildlife sanctuaries, petting zoos, because of the amount of disease that we've seen in so many different bird species. A lot of our other bird enthusiasts, and if you think of falconers or wildlife rehabilitation centers, zoos with special collections or aviaries, they may take different actions with the knowledge that the virus is closer or that we're seeing it in different species in their state. So the information is shared rapidly to allow for actions to be taken. That's exactly the point of this surveillance, is understanding where the disease is and if we have any changes in the virus over time that could cause it to cause different types of disease, or again, like we talked about, the presence of disease in mammals or in other species. So we share the information widely to allow folks to take that appropriate action.
That's great. That's great. We talk often about waterfowl hunters and others in the bird conservation community being citizen scientists, contributing data in one form or another to state, federal universities, and other entities that then take that information to make informed decision to help achieve a better outcome for something that may be in question, whether it's understanding of migratory bird behavior or conservation planning, or in this case, trying to mitigate the risk of disease spreading into commercial facilities or whatever else that zoos the case may be. So that's great. Always like to tie the collection of information to some actions and to help people realize what it is that they're contributing to. So I appreciate that. And so that kind of leads to this idea of the important role that hunters play in this entire effort. You and I first met a few weeks back when Ducks Unlimited and USDA was having conversations about import restrictions related to harvested game birds from Canada. And of course, that entire discussion centered around the role that hunters can play in potentially spreading this virus because of our close interaction with waterfowl. Can you talk about that a little bit in terms of why waterfowl hunters are such an important part of this equation?
Hunters have a very important role, specifically this year. As we said, this 22 outbreak is very widespread in so many states and the provinces in Canada. Hunters are a component to let us know when there are morbidity or mortality events, and that's just a fancy scientific word for detections of sick or dead wild birds. We've had reports come in areas where we just simply can't get to, or we don't have boots on the ground. And a lot of times it's game folk or hunters who are out in the wild in much more rural or more difficult to access areas who let us know that there's a snow goose mortality event, there's Canada geese that are dead or sick, or there's mallards, and that allows us the opportunity to determine if we should test those carcasses, if we haven't detected disease in that area, and if we should be submitting or finding new information. So the information that can come from hunters, both just in awareness where we might have sick or dead birds that potentially haven't been reported yet. And then part two is that information where we have voluntary collection of samples from hunter check stations and other concentrated areas in hunting seasons where waterfowl stage and congregate during migration or over winter. So getting access to those samples and really building up that body of knowledge. We're talking tens of thousands of samples this year alone that will be evaluated for the presence of disease. And we just simply can't get that many samples without the participation of our waterfowl hunters.
Julie, I wonder if it'd be worth talking for a minute about likely paths of transmission when we think about the waterfowl hunters and the actions we're going to be asking them to take. And one of the logical questions is, well, what is the possible path of transmission from me as a waterfowl hunter or my gear to one of the high risk groups of birds, commercial poultry, backyard poultry? I know from talking with Dr. Stalneck, I know that it's very difficult to trace the exact path of outbreak or infection, but maybe just speaking in general, our understanding of the virus and what we know about how easily it spreads and what the possibilities are for hunters and anyone else that interacts with waterfowl to play a role here.
Great question. So avian influenza spreads through direct contact from bird to bird. However, it can also spread to birds via contaminated surfaces and materials, including people's clothing or shoes or hands. We do recommend that hunters handle birds in the outside in well-ventilated areas and do multiple steps to reduce any transmission if there's virus in that hunting area or in the birds that they've handled, to avoid being the source of the transmission from hunters and handling of harvested birds into any backyard facilities, or of course into any commercial facilities or any other areas like we talked about, aviary zoos and other types of bird collections. We advise that hunters don't handle any sick or dead birds, especially with bare hands. The basic concept of washing hands with soap and water immediately after handling game and using some alcohol-based hand sanitizers, and avoiding anything that causes transmission from field dressing back to the house. So bagging clothes, doing a cleaning and disinfection step of the shoes that you used in your game cleaning area. It's a simple step of wearing rubber footwear and clean and disinfect shoes before entering or leaving the area. And we do recommend that folks have dedicated tools, the utilities for cleaning the game, whether in the field or at home, and do not use those same tools around any poultry or pet birds or backyard flocks.
Julie, I'm going to try to get inside the mind of some of our listeners on this episode. And, as I think about it, it's like, okay, well, maybe the risk, I would say that, man, the risk has to be so very low of me spreading it to this place or that place, because I'm not a high risk individual. I don't high risk movements, don't wear my waders here or there. I don't I can imagine a whole number of reasons why people might want to downplay the risk of them being a potential source of transmission, but it's not just that plays into the seriousness of this issue. There may be a low risk of, and I'm not saying this is the case, but in theory, there may be a low risk of a person or something transmitting a virus in this case, but if the outcome of that transmission is so profound and so severe, then that fundamentally changes the way we have to think about even a low risk of being a point of transmission. Am I correct in thinking about it that way?
That's a great way. And I actually just went to a talk last week where someone put a little calculation that risk equals the possibility times the consequence. And so just as you were saying, the possibility could be considered low, but the consequence is dramatic. And just as your example was with the hairdresser, if this virus is introduced into a backyard flock, into a zoo, into a commercial facility, into a wildlife rehabilitation center, the entire property is depopulated if the birds don't naturally succumb to the disease. So all of the birds on the property are depopulated or euthanized. The consequence is catastrophic. And so everything that all of us, can do to avoid any transmission. And I live in Fort Collins. We have every block on my street has one or two properties that have 5 or 6 chickens in the backyard. A lot of people have taken to raising local chickens or, having a tiny flock in their backyard just for local eggs. If the virus gets into those backyards, those birds are going to die from the disease. So the consequence is staggering. And again, we're talking over 48 million birds that have already been lost in 2022 in the United States. So I think it's worth taking the effort. And we know that it circulates in wild waterfowl. So the migratory waterfowl are one of the sources of the virus. Our waterfowl hunters can therefore certainly be exposed or be one of the routes for potential movement. So taking these extra steps really does protect all of the birds in North America.
Absolutely. And with that as our backdrop, I want to ask you a few questions from a hunter perspective, thinking about what do I need to know? What guidance can you give me under a variety of scenarios? You've talked about how to wash our hands, disinfect our hands, have dedicated equipment. And I'll ask you again about some gear here later on. I think you may have already covered that, but I want to be doubly sure. But what about encountering sick or dead birds in the field? What should a hunter do?
We do not recommend handling of sick or dead birds. One, because the possibility of virus being there is higher, and we don't want to be the source of any type of a virus movement. I do recommend, and most states have dedicated hotlines or ways of reporting at this point. Especially if it's a larger amount, several birds or something that looks particularly alarming, calling your state Department of Wildlife or game agency to report that. Those will be evaluated on a case-by-case basis to see if any additional testing is needed or if there's anything that might be done as far as cleanup. Mark the location, especially if it's in a rural or remote area, and report that to the state wildlife agency in your state, and they will determine if additional testing or any mitigations are needed. All birds are not being tested, of course, because we have to be mindful of our laboratory capacity and the amount of testing that they're doing right now, literally in the tens of thousands. So every single bird will not be tested, but it's always good to have knowledge as far as where these are and, determine if an investigation is needed.
Piece of guidance that I gave earlier this summer, and it bears repeating now, is that one of the best ways to kind of equip yourself or to position yourself as a hunter to be able to do that is to equip yourself now before you go afield with that number. Look it up, have it with you, put it in your phone, because I know how it is when you're out there in the field, you're hunting, you've got a lot of different things going on. It's easy to say, well, I'll wait and I'll look up that number later on. Have the number with you at that time so that you can just act on it at that moment. That would be the advice that I give to people.
That's a great idea. And I think some simple precautions before they go out, as far as having a pair of disposable gloves that you can use when cleaning game, some ability, soap and water available to wash your hands, and some alcohol-based hand sanitizer, taking an extra step to put a change of clothes, and some rubber footwear, a way to clean and disinfect shoes before you enter or leave an area, and taking those steps so that there's the possibility of having the field clothes and then the clothes you bring back home, so that none of the hunters unintentionally bring the virus back with them. Specifically important in areas where you might own poultry or backyard or pet birds.
And then what about bird cleaning and carcass disposal? What's the guidance to hunters on those things?
We are recommending outdoor field dressing in any cases where it's possible, well-ventilated outdoor areas. If it's possible, the recommendation is to double bag any offal and feathers, tie a bag, take off the gloves, and then put another bag around that, and then wash hands and use hand sanitizer. It's important to dispose of those intestines and feathers or any discard in a safe area where there won't be any exposure to poultry or pet birds, and to make sure that any other scavengers or animals can't get into that.
Now, what about, and I know you've had this question before, I can't remember, not on this episode, but I'm pretty sure I've seen an email where this was discussed. What advice then do you give to, let's say, outfitters, people that may be processing for the sake of their clients a large number of birds? Is there any situation in which burying the carcasses to a sufficient depth becomes the preferred strategy? What's the thinking on all of this?
It's hard to do a one-size-fits-all, and certainly for areas where they may be processing, hundreds, I'm guessing hundreds or thousands of birds. Appropriate disposal is somewhere where we don't have exposure to scavengers. And again, we have seen the disease spill over into foxes, skunks, raccoons, coyotes. So avoiding those type of exposure, a deeper burial is a possibility. But if it's feasible that we can get those into the trash or double bagged where there's not going to be any ongoing exposure, is probably the best route that we can take. And then going back to the guides or commercial, being really cautious as far as cleaning and storage of gear, including waders or ATVs or decoys. Washing those tools and surfaces with soap and water, letting them dry, and then a disinfection with a 1 to 10 bleach solution is a really good and great way to disinfect and make sure that we're not potentially, if decoys are used in one watershed and then you go to another area, we certainly don't want any of the equipment being a route for the virus moving through the areas either.
And then here's an interesting one for you, and I know that situation is out there in a lot of different places. A waterfowl hunter who has a retriever that they take with them, and then they also have backyard poultry. What guidance do you give to them on how to, I'm guessing, wash their dog after they get back from every hunt, or keep it separate from the backyard poultry? What's the guidance there?
Both of those are reasonable. And I do want to reiterate, we have not had avian influenza detection in domestic dogs in 2022. We get that question very frequently, and especially with the recent findings where it's been in wild canids, foxes and coyotes. Is there a possibility that we could see it in dogs? I can only answer that we haven't seen it yet. If there's an obvious sick or dead bird, I would be pretty careful about having a retriever have that bird in their mouth. And certainly if a dog were to get ill, we would work with the veterinary staff. But again, we have not seen detection of this virus in domestic dogs for the outbreak. I don't think it's a bad idea to have those dogs get a good bath and get a dunk. They could certainly have it on their fur, on their feet, especially if they're in waterways. And in a case where a waterfowl hunter also owns backyard poultry, we would want to avoid any exposure or any movement the same way we would, same as footwear or clothes or any other equipment. Keep the dog away from the poultry as well until they're cleaned up. You just gave me one additional thought. It's not a bad idea to run your car through a car wash on your way home and avoid, just get those truck wheels and the rest of the equipment on out. Certainly our responders in the field, we run through car washes almost every day. We're giving the car wash industry a little bit of a boost this year with the amount of washing of our own trucks that we have going on right now.
Yeah, I would imagine so. So, Julie, one other thing that I wanted to ask, I want to make sure we get it out there, is what's our latest understanding on the risk to humans, either from physical contact with a potentially infected bird or consuming harvested waterfowl that might have it?
Avian influenza viruses rarely infect people. We've had one possible case in the United States this year, but we do certainly advise that hunters still protect themselves. And some of those are relatively easy. Do not eat, drink, or put anything in your mouth or around your face while you're cleaning or handling game. We want to avoid any cross-contamination of raw meat to cooked meat. And in general, go with the basic standards of cooking game meat thoroughly. Poultry should always reach an internal temperature of 165 degrees to kill parasites and organisms. And just general safety precautions of washing hands and washing equipment to avoid any exposure to people and to avoid any contamination when handling raw meat or field dressing the birds.
Now, Julie, how many times have people told you that, if you cook a wild bird to 165 degrees, it's not worth eating?
That's a poultry recommendation.
Yeah. I kind of have to follow up with that just for my own credibility. So, but no, I understand what you're saying. That's a CDC believe that's right. CDC recommendation, or is that a USDA? Kind of curious there.
That's a USDA recommendation on the standards for poultry temp.
And I understand that that's the guidance you have to provide on this also. And so I appreciate you doing so. And anything else that we need to talk about here? I'm looking at my list, and I think this has been a fantastic conversation, but I want to make sure that if there's anything else that we need to discuss, we do so.
I just really want to thank your cooperation and the involvement for this. It's a critical juncture in this outbreak, and we're certainly still finding active virus in so many areas and in so many different species of birds. We cannot do this on our own as a federal response or as a state response. It really does take the general public. Of course, our industry and stakeholder partners on the poultry side are well aware and are working, diligently to prevent virus from entering their facilities. But our hunters provide a key component right here, both in us understanding where disease and sick birds may be and in helping us continue to gain those samples so we understand what's going on with the virus. So I just appreciate the time to connect with these folks that might not always hear from us on the science side, that we're very happy to have their participation. We need it for our surveillance, and we certainly want to continue to understand what's going on with the virus and do our best to mitigate any additional losses on our poultry side.
Well, the feeling is mutual. We appreciate the cooperation and collaboration of USDA, APHIS, and all the different departments within USDA. Nothing that we do within this organization or the conservation community is done unilaterally. We are all about partnerships, and y'all have been a great one, and appreciate that. And thank you so much for your time today. It's obvious that you know a few things about this, and I'm glad we have you on our side. I'm glad we have you in the game on this.
Thank you so much. Appreciate the time. And hopefully we're not talking several months down the road, but appreciate all the work you folks are doing on the conservation side as well.
Absolutely. Thank you, Julie.
Take care.
A special thanks to our guest on today's episode, Dr. Julie Lenoch, National Coordinator for APHIS Wildlife Disease Program. We greatly appreciate all of her time and expertise in help in this very important situation. As always, we thank our producer, Chris Isaac, for the great job he does on these episodes, getting them out to you. And to you, the listener, we thank you for your time and for your support and commitment to wetlands and waterfowl conservation.
Thank you for listening to this episode of the DU Podcast. Be sure to rate, review, and subscribe to the show, and visit www.ducks.org/DU Podcast for resources based on today's topics, as well as access to more episodes. Opinions expressed by guests do not necessarily reflect those of Ducks Unlimited. Until next time, stay tuned to the ducks. Stay tuned to the ducks.